Are there non-surgical bladder treatment options for stress incontinence? Stress urinary incontinence is when urine leaks involuntarily during activities that put pressure on the bladder, like coughing, sneezing, or exercising. While surgery is a common option for severe cases, there are several non-surgical treatments that can help improve bladder and pelvic floor health. One of the first lines of treatment involves behavioral therapies and pelvic floor muscle exercises. These exercises, often known as Kegel exercises, focus on strengthening the muscles that support the bladder and urethra. By doing these exercises regularly, many people find they can reduce episodes of leakage. Other techniques may include bladder training, managing fluid intake, and using biofeedback to enhance muscle control. Ultrasound-guided pelvic floor exercises have also shown effectiveness in reducing incontinence severity and improving bladder emptying. For those who prefer to avoid surgery, urethral bulking agents offer a minimally invasive alternative. These agents are injected into the tissues around the urethra to help improve closure pressure, which can significantly reduce urine leakage. One example is Bulkamid, a hydrogel that has been successfully used in women and is also being studied for men, especially those with stress incontinence after prostate surgery. This procedure is generally low risk and can be performed with local anesthesia. While medications are more commonly prescribed for overactive bladder symptoms, some medications that relax the bladder muscle or alter nerve signals may provide relief in mixed cases of incontinence. However, it is important to note that no medications are specifically approved to cure stress urinary incontinence, and their effectiveness is limited compared to behavioral and procedural options. Another option, although not typically used for pure stress incontinence, is Botox injections. These injections help relax the bladder muscle and reduce involuntary contractions. They may be considered in cases where patients experience both urgency and leakage. In summary, non-surgical treatments for stress urinary incontinence include pelvic floor muscle training, behavioral modifications, and minimally invasive procedures like urethral bulking injections. These treatments can be effective, especially for mild to moderate cases or for those who wish to avoid surgery. If you are experiencing stress incontinence, it is essential to consult a healthcare professional who specializes in bladder health. They can provide a personalized evaluation and treatment plan tailored to your specific needs. Maintaining strong pelvic floor muscles and bladder function is crucial for overall urinary tract health. Non-surgical treatments can enhance natural muscle control and bladder function without the risks associated with surgery. However, patients with bladder cancer or other bladder conditions should always seek specialized medical advice to ensure their incontinence treatments do not interfere with their cancer management.